Hi guys, Arnold Bride here with another news update on men's sexual health. And in this news story, we will be talking about what causes erectile dysfunction. If you'd like to see other news stories and videos about men's sexual health, just subscribe to this channel by clicking on the arrow or following the links that are below this video. Male erections are a complex process. They involve your brain, your heart, your blood vessels, and psychological issues, stress, performance anxiety, and if any of these things get messed up, so will your erections. The first area we want to look at is cardiovascular issues. That includes heart disease, high blood pressure, high cholesterol, and clogged arteries. An erection is based upon blood flow. The penis becomes enlarged because blood flows into it. If you have heart disease, high blood pressure, high cholesterol, clogged arteries, the blood flow is compromised, and so is the erections. The other problem that you run into with heart disease and high blood pressure is that it hurts the lining of the vascular system, which is called the endothelium, and the endothelium produces nitric oxide. Nitric oxide is critical in relaxing the blood vessels so that blood can flow. Without nitric oxide, you will have high blood pressure, you probably will have some levels of heart disease, and you definitely will not have an erection. Some diseases that cause erectile dysfunction are diabetes, multiple sclerosis, and Parkinson's disease. MS and Parkinson's disease are nerve conductivity issues. Diabetes is a cardiovascular issue when it applies to erectile dysfunction because high blood sugar will destroy the lining of the vascular system, which, as we just talked about, is the endothelium. Once the endothelium is compromised, nitric oxide production is compromised and therefore no erection. Two lifestyle issues are being very overweight and substance abuse. If you're doing a lot of prescription and or non-prescription drugs, there's a good chance that you're going to wind up with erectile dysfunction. If you're very overweight, one of the causative factors for diabetes and cardiovascular issues is weight. The more overweight you are, the greater the chance you have of having cardiovascular issues. So if you're overweight, obviously one of the first things to do is to try to lower your weight. For younger men in their 20s and 30s, being overweight is one of the major causes of erectile dysfunction. We were talking about nitric oxide being an important, if not the most important, factor in having an erection. Nitric oxide therapy is a great natural therapy for cardiovascular issues, diabetes, high blood pressure, and as we're talking about erectile dysfunction. If you'd like to see a great video on nitric oxide therapy, just click on the arrow or follow the link below this video. If you have any questions about any of this, just give me a call, 609-410-4790. That number is also in the description below this video. I want to thank you for stopping by, watching the video. Have a great day, and here's to your good health.